Hello dear patients. In this video, let's talk to you about the tummy tuck surgeries. So there are three main components of tummy tuck surgeries. The first component is the liposuction, second component is the skin removal, third component is the muscle stitches or muscle plication sutures, what you do. So we always start with the liposuctioning first. We first do the liposuction, especially we start with the back side of the patient. We take fat from the back, upper back and the lower back and also the flanks. So when you finish with the lipo of the back side, we just change the patient position in the table and we start the liposuctioning of the stomach. So when you finished fully with the liposuction on these stomach areas, then you're going to have a very loose skin and it's going to be very nice for us to reshape the skin. The second component is the skin removal. Okay, if you want to remove a skin, you need to make a cut. And the most important thing for the tummy tuck surgery is the skin cut level and the length. For me, the most important is not the length of the scar, but the important thing is the if you can put this incision as low as possible, it's going to be the best for the patient for a long-term result. So, how do you choose the incisions? There is the pubic area here and there is the inguinal creases here. You just try to put the incisions in the bikini line, so we don't want it to be visible. In order to do this, we just make a skin cut plan before you go for the surgery, so we just obey our drawings and markings. The scar is going to be just 1 centimeter above the inguinal crease and maybe 7 centimeters below the pubic area. So in this way, you can achieve a nice hidden scar. But the length of the scar is sometimes changes because in some patients, they only have a little bit extra scar in the lower belly, and with a small cut, you can just finish it from bone to bone incision. But in some patients, it's not enough. So if the patient has a very big belly, and especially the belly is on the lateral sides a lot, so you have to do a kind of bigger incision. So in order to make that bigger incision, you just make it a little bit longer. It's almost 180 degree of cut maybe in some patients, sometimes 270. It's up to the extra skin what you have in the flanks. So if you have less skin, the cut will be small. If you have more skin, the cut will be a little bit longer, but it's going to be, of course, your surgeon's decision. So when you decide about the length of the incision and the height of the incision, then you make the cut and you just work above the abdominal wall. So we never touch the inside organs or anything. We just stay above the muscle. So you make a dissection just below the ribs, and in the upper stomach and the lower stomach, you dissect and open all the tissues, but you just keep the belly button in the same position. The belly button will be your original belly button, but just we're going to make a new hole for it. So when you finish with the dissection, you just directly visible, you can just directly see the abdominal muscles. And if there is an hernia inside, you can repair it. If there is a diastasis, I mean if there is a separation, you can also do the internal stitches to close, to make the stomach more tightener, and you just close the abdominal wall more closer. So when you open it, when you see it directly, especially 90% of the patients has these problems about the diastasis. When they have babies, the muscles become separated from each other, and you just make a cut, make a stitch like this from all the way up to the xiphoid bone, up to the pubic area. You just make tightening of the abdominal wall from inside. So in this way, the patient is going to be more slimmer because of these sutures inside. The patient's stomach will be more smaller, and also it helps us, especially from the lateral view. You can see some patients, even they don't have fat, they see a little bit bulging on the side view. So when you make stitches and when you push the belly back, so it helps you to have a more flat stomach. And this is the second part of the tummy tuck surgery, the plications. And the last part is the skin removal. So when you make a skin cut, when you finish with the lipo, when you make the skin cut, when you just finish with the muscle stitches, then now it's time to remove the skin. So the advantage of the liposuction starts on here. So when you have a more loose skin, so you can tighten it more. And when you come to ideal position, you just remove the extra skin below. You just stitch the areas and you make a new opening for the belly button. For me, the most important part of this surgery is the belly button stitches, because that's the only visible scar that people can see you. So for my style, I just try to bury it in a very deep position, because I don't want the stitches to be outside like a sun. So I just try to bury the belly button in as low as possible. So I make the stitches in a lower point, and I'll just remove some extra skin around the belly button to make it look like depressed and to look like original. And also when you're finishing the surgery and when you're just giving the shape, if the patient is suitable, you can also give definition to the tummy tuck patients too. You can give definition for the midline, and you can give definition for the sides with the liposuction at the end of the surgery. And then you just make your stitches. Don't worry, we always make the stitches like dissolvable stitches. No need to take the stitches out again, and we just put some sterile strips over the wound, and you keep them at least 10 days or 15 days with you. As a summary, the surgeon will finish all these three components: liposuction, muscle stitches, and the skin removal. At the end of the surgery, you're going to wear your corset directly in the table, and you will go to your room with that corset, and we will help you about your aftercare too. Thanks.